Good morning to all of you guys. Thank you for joining us here today. My name is Joel Campos. I'm Director of Community Outreach at Second Harvest Food Bank. And first of all, I want to thank you guys all for being here, joining us today. It is my great pleasure to welcome you to the 9th Annual Calfresh Forum 2021. Before we get started though, let me tell you some of the housekeeping rules. Please mute yourselves. And if you have a question, please use that chat box. Also, this event will be recorded for training purposes. Presentations will be available and shared after the event. Please complete the evaluation, the survey that you're going to get, as this will help us to do better next year, hopefully not in Zoom, in person. And also, to receive this very cool t-shirt that we got. Also, I want to take this opportunity to recognize our partners, as well as to all the presenters who graciously agree to share their wisdom with us today. They either contributed their time or funding to make this event happen today. And without their experience and help, we will not be able to put this event together. So thank you to Santa Cruz County Human Services Department, Kaiser Permanente, City of Watsonville, and last but not least, Santa Cruz County Health Services Agency. There's no question that this year has been an unprecedented year, a year that has put our community kindness and empathy to the test over and over, literally. Because we have two major disasters within the same year. While our community was battling the coronavirus, our forest went up in flames, leaving over 1,500 families without three of the most important needs: shelter, water, and food. But our community is tough. And you know what they say, what doesn't break you, it makes you stronger. And it did just that. In this case, it brought us all together, united us all up to help fire and pandemic victims alike. Some agencies and individuals provided shelter, food, donated money, or their time. Today, we have a full agenda here at the forum with some great workshops and presentations. We brought the best of the best from all corners of our county and the state, from disaster Calfresh, pandemic EVT, to innovative outreach strategies, and way more. Just watch. Without further ado, I do want to introduce the person that will introduce our future speaker. So here with us is Rocio Ortiz. And thank you very much once again. We appreciate you guys being here.
Good morning, everybody. I hope everybody's doing great. Thank you for joining us today. And as Joel mentioned, I will be introducing our featured speaker for today's forum. Welcome, Randy.
Is that my introduction? Am I on?
Yes.
Okay. Well, I heard Joel say best of the best, and then you call me feature, so the pressure's on. So good morning, everyone. I'm Randy Morris, and I'm the director of the Santa Cruz County Human Services Department. And I hope I am not the only one on this call who cannot wait to be done with these Zoom video meetings and have these meetings in person sharing food together, a privilege given the topic today. I started my position in February of 2020, March being when the pandemic hit. So I was here for a full month. And then in March, the pandemic hit. And I will never forget, given this is a forum with Second Harvest Food Bank. So to all of you, I don't know how many of you worked there a year ago, but the lovely event that was the last event I participated in the community on Ocean Street at the hotel when Second Harvest Food Bank had your yearly award ceremony. thanking community partners, public partners, education partners for work helping people who are facing food insecurity. And we were scheduled, and I was scheduled to actually participate in last year's event that we're having today in May, but that was canceled and the world turned upside down. And in my few minutes, I've been asked to be the best of the best and share some introductory remarks. I'll share a couple of reflections I have on this last year. As was stated by Joel, the pandemic and the recession that followed and the fires that followed have created a moment that I don't think any of us knew how to plan for, but has certainly challenged us all. And food insecurity and more has been highlighted as something deep and profound. But I think it's thanks to the success of the partnership of us in government and community members on this call that we rose to the challenge. And I just want to take a minute to recognize that challenge, but I really want to underline that that challenge was only met because of partnership with community. If you don't know, county human services and many county programs, including health programs, are predominantly funded by federal and state funding streams, and the regulations that govern our work are predominantly created in Washington, DC, and Sacramento. And so it raises the question, what do we do locally? And what we do locally is we either have great partnerships or we don't have great partnerships. And in a place like Santa Cruz, where the partnerships thrived this last year, I think we bring a lot of the great opportunities forward that the federal and state government give to us, like funding the federal SNAP program, California's Calfresh program. Just gonna share a couple quick highlights and then end with some words of hope and inspiration and challenge, because we have a lot more to do. You may or may not be aware that the Second Harvest Food Bank Director, Willie, reached out to us in Human Services, I think it was in April, and said, we are in a world of hurt with food insecurity that is going to unravel and get bad. And can we please partner government and community to figure out how to help the most vulnerable so that they have food? And that led to a whole series of actions that I'm not going to list all of them, but a few I want to name. First, we were able to partner with Second Harvest Food Bank to draw federal FEMA money with local match that the food bank found to bring millions of dollars of food to the community. And that was a public-private partnership. Calfresh, to the human services employees on this call who took on the huge spike in Calfresh applications. And those of you on this call who helped community members apply for Calfresh, we handled a large volume of Calfresh applications and got people that benefit. We stood up a program called Great Plates Delivered, which was a federal and state funded program that helped get almost 1,000 older adults who were sheltering in place and highly vulnerable and low income, 3 home delivered meals a day. And we also stood up 11 shelters to help those who are unsheltered or at risk of COVID, getting into shelter systems to have a place to live during the pandemic and also get 3 meals a day. So that's just a quick summary of a lot of things we've done. And I just want to end with the work ahead. The recession is not over. The pandemic is still here. And for those of us, given the topic today is Calfresh, I believe most everybody on this call is very familiar with a challenge that we are all recovering from, and that is over the last 4 years, we had a president and a federal administration who really tried hard through many efforts, including something called public charge, to basically create fear in the community so people eligible for government services would not apply for them. So we do still, in reaction to that fear that got created by a lot of federal rhetoric and federal policy that finally was overturned by federal courts, a lot of people in our community who are eligible for Calfresh don't know they're eligible for Calfresh, or maybe they do, but are fearful to apply for Calfresh. The only way we're going to help those eligible to apply for and enroll is in partnership with many on this call, many who work in community, Second Harvest Food Bank and others. So I hope we can continue to work together, though we should pat ourselves on the back. I think we have a lot more work to do, and I hope we can do that work together. And I hope that today's forum is a bit of a reminder to use this annual forum that we have done great work, but we have more work to do. So I hope I rose to the challenge to be best of best, and I'll turn it back to you all. And I'm going to listen in until 9 o'clock when I have to tune into the Board of Supervisors. But it's nice to virtually meet you all, and I look forward to meeting you all in person someday. Thank you.
Good morning, everybody. My name is Maria Ornelas, and I'm not sure that you can see me right now, but maybe in a few minutes. I just want to take a few minutes to say good morning, welcome. As Joel said, in partnership with Second Harvest Food Bank, with Santa Cruz County and Calfresh, we do a lot of outreach and coordinating. And to talk a little bit about May being Calfresh Awareness Month, we have two speakers. We have Kimberly Peterson. She's the division director with Santa Cruz County, the Human Services Department. And we have Josue Barajas, Chief Program Officer with Second Harvest Food Bank. So they'll just kind of be touching up on May being a Calfresh Awareness Month and some of the things that we do to spread the word. So Kimberly, are you there? Okay, I see you. So Kimberly Peterson will go, and then Josue afterwards.
Thanks, Maria. And thank you to everybody. I'm really glad to be here today in some form, reconnecting on the work that we do. As Maria mentioned, I'm Kimberly, the director of the Employment and Benefit Services Division at the County of Santa Cruz Human Services Department. And in this division, we administer various public assistance programs, Medi-Cal, CalWorks, and General Assistance Cash Aid, employment programs, and then of course, Calfresh. I want to continue that theme of partnership and cooperation that a couple others have mentioned, with the shared goal of supporting our community. Everybody here, and as we focus on Calfresh Awareness Month, we're all here and part of the web of safety net services that help us close or at least reduce the gaps in food, financial, health, and even housing insecurity in the community. From the time that I started working with many of you years ago, I've known some of you for years, as we were preparing for the implementation of the Affordable Care Act, I've continued to be amazed by the commitment and passion of the people that make up our local safety net. That includes the employees within the county and all of the employees of our nonprofit partners. So we're here today to share information about Calfresh and celebrate some of what we've done over the last year, which has been quite a year. I do want to take a moment, though, to go back to where we were at the last Calfresh Forum 2 years ago. At that time, in 2019, Calfresh caseloads were declining. A change to the public charge rule had been proposed, contributing to a chilling effect for access to benefits among our immigrant families, the immigrant families in our community. And we were getting ready to expand Calfresh eligibility to seniors and people with disabilities on SSI, which was going to be the first time that population was eligible for Calfresh since 1974. Through our collaborative efforts with many of the partner agencies on this meeting, we now have over 6,000 seniors and people with disabilities who are now receiving Calfresh. That is an increase of almost 3,000 since May of 2019. At the time that policy change occurred, which was June 2019, we processed 800 applications from seniors and people with disabilities in that month alone. Just to go back and acknowledge our past efforts and what we've achieved just at that time. The public charge rule, which was changed despite much opposition, has fortunately since been reversed, reopening the door for some immigrant households to access critical support such as Calfresh. So that brings us now to this year and the impacts of the pandemic. In April of 2020, that time that Randy mentioned briefly, we received 2,374 applications. Compare that to about 1,500 applications in March, and compare it to about 950 applications that were received the prior April. So in April 2019, we received under 1,000 applications. In April of 2020, it was over 2,300 applications. A significant increase, to say the least. Over this past year, the number of people receiving benefits has fluctuated in Santa Cruz and statewide. We had a peak of about 29,400 people receiving benefits in May of 2020, and that went down to a low of about 25,000 people in November. Currently, we have about 26,400 individuals receiving Calfresh in the community. We think the fluctuations are likely due to a variety of factors, ranging from some of the stimulus payments, various unemployment benefits, people not knowing that they may be eligible, or meeting their needs through other ways, through family or friends. Currently, as we look at where we are at this moment compared to where we have been in the last year, the vaccine distribution and the reopening of the economy in Santa Cruz County is looking more hopeful. Things are beginning to open up, but we know that we still have a lot of work to do to recover. We know that there are people who are not reaching out for benefits that would qualify for Calfresh. And so as we move forward, we know we're going to need to reach out to people who are not currently receiving benefits but need them. We know that we'll need to work with people who are unhoused, people who are leaving shelters, and people who may be losing access to the Great Plates program at the point that that program discontinues. And a major focus will need to be on families with immigrant household members. We know that we lost ground with immigrant families over the last few years. And we also know that, that we lost ground in particular with children within those households. So as we move forward, that will be our major focus of outreach. As we do that, the only way that we can do so is working with you, listening to the community, trying to overcome the concerns, and then enrolling people back into the Calfresh program. We have done amazing things over this last year. As Joel mentioned, everything that we overcame and what we dealt with as a community. Also, as he said, what doesn't break us makes us stronger. So let's keep going forward, stronger, building our partnerships in support of our community. Thank you.
Good morning, everybody. Thank you, Kimberly, for those powerful words. Wow, I can't believe we're in May already. Where has time gone? As many of us had mentioned, last year was truly one for the books. On March 16th, our county and our state went into lockdown, and as we saw, our unemployment skyrocketed. Here at the food bank, we saw our need grow over 60% overnight, and our staff began to be innovative in order to meet the needs of our community. And just as we were getting the hang of things, just like everything that happens in life, on August 16th, Santa Cruz County was struck by the CZU lightning complex fires, which burned for 38 days and forced as many as 75,000 people to evacuate. One of the biggest things to note about May is not only that it was Mother's Day on Sunday, but that it's also Calfresh Awareness Month. And it's a time of the year where our dedicated Second Harvest staff and our great partners at the Human Services Department County push to get as many people enrolled and educated in the Calfresh efforts that we're doing. And in hopes is that all of the people that we are teaching and that we're showing all of these resources, utilize them. And as was mentioned by previous speakers, we know that food insecurity has gone up throughout this year, and we have truly now put it into the spotlight. If there's one thing that you take away from this forum, is that Calfresh is the first line of defense and the best tool we have to combat malnutrition amongst children and amongst our most vulnerable members of our community. Again, this past year has showed us the new faces of food insecurity and has showed us that we cannot mask hunger. Speaking from personal experience, my family would have never been able to get the healthy food we needed if it wasn't for the resources that Calfresh provided. I want to recognize all of the people that it takes to make these efforts move on. All of our partners, all of our nutrition sites that we have, and all of you. You all have started to take the first step to become what we call a Calfresh buddy or a Calfresh ambassador. And that is by being here, getting informed about all of the Calfresh efforts that we're doing and what the new Calfresh policies that are. You play a big role in continuing to foster the community and continuing to debunk some of the myths that Calfresh has. So my challenge to you is to take whatever you learn from this Calfresh Forum and to continue to put it forward and to tell a neighbor about the great resources that you learned today and to learn about all of the things that we can do to help our community be, to fight malnutrition. Thank you.
Good morning, all. Thank you, Kimberly and Josue. Next, we have an informative presentation given by Madeline Dembski, a health educator for Calfresh Healthy Living. She will be speaking about an awesome program called FoodRx here in Santa Cruz County. If you have any questions, please feel free to put them in the chat box. We will keep track of them for Madeline. Thank you.
Great, thank you. And one moment while I share my screen. Okay, great. And thank you to the Calfresh Forum team for the opportunity to present and share about FoodRx. My name is Madeline Dembski. I am a health educator with Santa Cruz County Public Health within the Health Services Agency. I am presenting on behalf of my colleague, Crystal Caballero, who is the project lead for our FoodRx program. And here's the agenda for today's presentation. I'll briefly cover food insecurity as an overview, discuss the nutrition assistance resources that are available as part of FoodRx, and discuss the recommendations we provide to medical staff regarding talking with patients about food insecurity. So there are many variations of food prescription programs, but all have the shared goal of reducing food insecurity. And food insecurity is defined as the disruption of food intake or eating patterns because of lack of money or other resources. It is also the limited or uncertain availability of nutritionally adequate foods to live a healthy life. And like we've discussed, many people who have been most impacted by COVID-19 were either food insecure or at risk of food insecurity before the pandemic. And so the COVID-19 recession has exacerbated this issue. And additionally, racial disparities in food insecurity that existed before COVID-19 remain in the wake of the pandemic. So this is a health equity issue as well. When we look at food insecurity locally, we see that this affects a substantial proportion of the Santa Cruz County population. According to the California Health Interview Survey, 34% of individuals in low-income households are affected by food insecurity. And this is paired with additional data on nutrition, obesity, and socioeconomic status, all which are interconnected with food insecurity. So this is a public health issue that Santa Cruz County Public Health and community partners are all working to address. And if we look at why this is such an important public health issue to address, we see that it's no secret that food insecurity contributes to poor health outcomes. The combination of stress and poor nutrition can make disease management even more challenging. The time and money needed to respond to health conditions strains household budgets, leaving little money for essential nutrition and medical care. And this can become a vicious cycle and increases the risk of chronic health conditions getting worse. It's important to remember that food insecurity is something that is often hidden in plain sight. You can't always tell if someone is food insecure just by looking at them. People may try to hide hunger from their children, their friends, family, coworkers, and healthcare providers. One reason could be because of the shame and fear in discussing these issues with others. And so that's why it's important to ask and talk about food insecurity, especially in the healthcare setting. Research does support the notion that the healthcare setting is an effective place to intervene on food insecurity. Patients are more likely to connect with support if they receive immediate assistance during a medical visit. There is also growing recommendations for clinic-based food insecurity, including referrals to community resources. And this really is the main focus of our FoodRx program. In healthcare settings specifically, best practices include ensuring providers understand the different local, state, and federal resources that are available, talking to patients about food and normalizing the conversation, linking food and nutrition to overall health and well-being, and providing information about local resources that are available. So far, we have partnered with county providers at the Watsonville Health Center, as well as pediatric providers at Sutter Health PAMF. And these are all topics that we discuss with providers when conducting trainings around food insecurity and FoodRx. And if you see here, these are the nutrition assistance resources that are available for providers to give to their patients. We have worked with the Watsonville Health Center and Sutter Health to add this to their electronic medical system. That way, at the end of the patient's visit, the resources will be included in the after patient summary and will be printed out and provided to the patient for them to take home with them. And this is what a workflow could look like for providers. It is recommended that providers screen all patients for food insecurity. And if a patient screens positive for food insecurity, providers will then print out the nutrition resource document that I showed previously, and then refer the patient to a Calfresh outreach worker or to a meal distribution site. I'd like to also note that this FoodRx project is still very new and has been initiated only for a few months now. We finished training providers in early February, and the Watsonville Health Center is currently working towards implementing routine food insecurity screenings for their pediatric patients during well child visits. So we're still in the very early stages of the project, and providers are currently working on adapting and evolving their screening process to best fit clinic visits. And also, they're also learning how to best handle data entry and documentation of these screenings in electronic medical records. When providers screen patients for food insecurity, we recommend that they use the Hunger Vital Signs Screening Questionnaire. This is a validated 2-question screener, and it's considered the gold standard for food insecurity measurement. It's a practical tool for clinic settings because it's only 2 questions. And this is also from the American Academy of Pediatrics, but it could be applied to other patient populations as well. It could be applied to other patient populations as well. And a patient is positive for food insecurity if they answer often true or sometimes true to one or both questions. And it is possible for there to be variations of these questions, and providers may need to make adjustments to their screening process to best fit their clinic visits. We also emphasize with providers that even if patients answer never true to both statements, they may still be in need and qualify for food assistance. Patients may be hesitant to discuss it with providers, so it is important for providers to build their own comfort and knowledge in discussing food security and food assistance. And this is why it's so important for providers to normalize food assistance when talking to patients. It's important to inform patients that assistance is available and most people will need it at some point. It's also important for providers to point out that they are recommending food assistance just as they would prescribe a medication. So connecting it to health is a helpful way to explain why food assistance is being recommended. Another aspect of FoodRx is to make healthy food and nutrition a part of the clinic experience. So visual cues such as posters, brochures, flyers, things like this can help to further normalize food assistance and help patients feel more comfortable talking about this with providers. And personal anecdotes are also helpful as well. So again, this is a brief overview of our FoodRx program. FoodRx it's still very new, and providers are working to adapt and evolve their screening practices to best meet their clinic visits. Food prescription programs are an important tool to utilize in the clinic setting because of how essential food security is for health. And providers have a unique ability to reach patients in need of food assistance, incorporate these conversations in their practice, and refer patients to community food resources. And there are many resources available on this topic. One that we've utilized that I'll leave with you today is this toolkit for pediatricians. And even though it is by the American Academy of Pediatrics, it does have valuable information that can be applied for all kinds of providers and all kinds of patients. So if you're interested in learning more about food insecurity interventions in the medical setting, this is one resource to look into. And again, thank you for your time and the opportunity to present about FoodRx. If you have any follow-up questions, here is our contact information. My colleague, Crystal, she's out on leave until June. And if you have any questions before June, feel free to contact me. And upon Crystal's return, she'll be the main point of contact for information related to FoodRx. Thank you.
Every year we nominate our best recipient for a Calfresh Champion Award. These nominees go beyond to assist and minimize barriers around Calfresh. Up next, we have Gabby Davidson representing the first set of Calfresh Champion Awards.
So I also will be sharing my screen.
We can't hear you, Gabby. I don't know if you're.
Okay, thank you. 1 year and I still don't know how to unmute. So every year we like to celebrate the individuals and organizations who collaborate with the Second Harvest Food Bank to help us advocate, enroll, and educate people about Calfresh benefits. Thank you to our Calfresh Champion Award nominees for your passion and dedication to end hunger in Santa Cruz County. Without your help, we would not have been able to help over 1,000 people get approved for Calfresh benefits this past year. Without further ado, our first Calfresh Champion Award goes to AmeriCorps NDMBA for their outstanding service in the fight against hunger and malnutrition. These 5 AmeriCorps members have been serving at organizations such as Loaves and Fishes and the Second Harvest Food Bank all year. They have gone out of their way to help us promote Calfresh by reminding other AmeriCorps members to sign up, inviting us to do outreach at food distributions, referring community members to the food bank to see if they're eligible, and assisting with Calfresh promotion at our own food distributions. Christina, the AmeriCorps supervisor, said that as the coordinator, I have always relied on Calfresh to supplement the AmeriCorps living allowance. Without Calfresh, our members would be spending half of their stipend at the grocery store. In a time when there is much to be insecure about, Calfresh ensures that our community members have access to healthy food. Thank you, AmeriCorps NDMBA, for your partnership and for all that you do for our community. Our second Calfresh Champion Award goes to Scott Thomas. Scott is always enthusiastic and welcoming to community members and does his best to make sure people at Nary Lagoon and Gall Apartments have Calfresh by inviting us to attend his food distributions and sending us referrals. He would like to say thank you for this award nomination. It is nice to help the food bank. This is the best food bank in the world, and Watsonville feeds so many people, and it is great to be a part of that process in Santa Cruz. Our next Calfresh Champion Award goes to Jillian Ritter, who managed the Recovery Resource Center during the CZU Lightning Complex fires to help impacted residents get back on their feet. Jillian invited the Second Harvest Food Bank to do outreach at this resource center, and we were able to help 58 people get approved for either disaster Calfresh and regular Calfresh. Jillian states that with a lot of help and support from other county staff, nonprofits, and community members, we were able to gather a number of local, state, and federal resources to provide initial and ongoing support, including Calfresh disaster outreach with the Second Harvest Food Bank. The CZU Lightning Complex fire was and continues to be a massively destructive and devastating time for our community. And I'm so grateful that I have been given this opportunity to help our impacted residents in this way. I feel that it is my duty to help our community be the best it can be, and I want to do all I can to support our residents. Thank you, Jillian, for this great partnership and for all that you've done for the community. So our next Calfresh Champion Award goes to the Davenport Resource Center for inviting us to do disaster Calfresh outreach during the CZU fires and continuing to support our efforts to get people enrolled in Calfresh by promoting it to community members who go to their center, sending us referrals, and helping community members send in pending verifications to their case. They would like to say that the strong collaboration between CAB, the Davenport Resource Center, and the Second Harvest Food Bank to best serve clients has been the best part of being a Calfresh buddy. Being able to support in closing food insecurity gaps, especially during the COVID-19 pandemic and the CZU fires, has had a huge positive impact on the Santa Cruz North Coast. Thank you, Davenport Resource Center, for all that you do. Over 1,000 approved applications that we have done this fiscal year at the Second Harvest Food Bank translates to over 1,357,000 meals, over 3,705,000 Calfresh benefits, and $6,632,000 into the economy. This wouldn't be possible without partnerships like these. So thank you, Calfresh Champion Award nominees, for all that you do for the Santa Cruz County community.
Thank you, Gabby. Santa Cruz County is a resilience community, and through the pandemic came innovation when organizations strive to continue to serve. Up next, we have innovation driven by the pandemic with your moderator, Nick Monsi, Agency Network Manager from Second Harvest Food Bank. And we have a great panelist, Alexis Fernandez from First by Santa Cruz County, Kennel Jean for University of Santa Cruz, and Lourdes Pollard, Garfield Park Village.
All right, thank you, Yusef, and welcome everybody. You did, okay, great. As Yusef was saying, I'm Nick Musi, the agency network here at Second Harvest Food Bank. Thank you. We have a very special panel of advocates and community leaders who are here with us today that I have the pleasure of introducing and speaking with about how they persisted in innovative ways to continue their crucial work through the pandemic. Lourdes Pollard is the Social Services Coordinator at Christian Church Homes in Santa Cruz, which provides affordable housing in caring communities where seniors can live and thrive in the comfort of their own homes. She connects residents to necessary supportive services in the community, provides case management, and develops programs and resources that support wellness for the entire resident population. Canel Jean is the director of the Basic Needs Program at UCSC, a multi-divisional operation that seeks to eradicate food and housing insecurities for UCSC students by partnering with all campuses in the UC system, on-campus organizations, and community-based organizations like Second Harvest Food Bank. Canel works with campus leaders to improve programs and seek new resources that will help them reach their goal. Alexis Fernandez is the Health Outreach and Enrollment Manager at First 5 of Santa Cruz County, which helps children succeed in school and in life by investing in programs that focus on health, early learning, and family support. Alicia oversees the Baby Gateway Newborn Enrollment Program, ensuring all newborns in the county have health coverage. So without further ado, we'll go ahead and jump into our questions for the panel. Alicia, this first question is for you. How did you adapt in those early days of the pandemic in the strictest parts of the shelter-in-place order? What did that look like, and how did that affect your work and the people that you serve?
Thank you. Like many agencies, we really started off really trying to figure out what exactly the shelter-in-place order meant for us. The first question was, were we considered essential workers? In our case, we're serving moms that are having babies, which wasn't something that was going to stop. So we needed to figure out how the program could continue following the new guidelines. I remember that during the strictest parts of the pandemic, the message heard was that you shouldn't go to the doctor unless absolutely necessary. If we remember, they were canceling all unnecessary procedures, yet newborns were expected to go see a doctor 2 to 3 days after being discharged from the hospital. So this understandably made moms very anxious. So one of our initial challenges was how to convince moms that it was safe for their newborn to see a doctor. We worked very closely with our hospitals, our local Medi-Cal office, and our local clinics. And despite everything that was happening, I'm happy to share that our program never stopped assisting moms with accessing Medi-Cal, Calfresh, and making their baby's first well-visit appointment.
Thank you, Alicia, and thank you for that great work that you've been doing and continuing to do throughout the pandemic. Lawrence, this question will be for you. Could you describe, just think back to a specific instance that was a learning experience for you in your work, and possibly as well a specific instance of success that came from trying to continue your important work through the pandemic, and if you could kind of touch on what led to that success for you.
What was one of the things that was difficult is that now we had seniors during the COVID that had to shelter in place. That meant all their support systems that came in to help them, and some of them were the most vulnerable, were not able, and they were senior orphans. Their family members couldn't come by. So there was a big need to bring in services and hook them up to the services. One of the things that was difficult is everything sort of went online. Some of them had dexterity problems, visual problems. They didn't know how to use social media. So it was a big learning curve, and had to start advocating to bring these services to them instead of asking them to get online and obtain the services or go somewhere to get the services. And that's where Calfresh came in also, which we managed to hook up a lot of the residents to that directly without having them get online and do that, and getting also we got tablets for them, and we just had to make close partnerships and change the way we functioned. And one of the successes was that the community did step up, and we're still advocating to making sure services come to the seniors instead of having the seniors go to services.
Thank you, Lawrence. Yeah, I think that's really important kind of struggle and challenge to highlight that I think you and your organizations were able to overcome successfully, is that digital divide. We often think about that as, you know, for our students, but our elders as well, right? So I guess in that, Canel, this question will be for you. At UCSC, do you ever feel like you got the hang of things, or did you feel you had to constantly adapt to meet the needs of your participants as the county moved through the different tiers and guidelines for the COVID-19 pandemic?
Yeah, good morning. I don't think we ever felt like we got the hang of things. You know, things are still changing and things are still changing. And we also had the CZU fires. We had and still have the racial unrest that's still going on in this country, and that impacted a lot of our students. So you know, it was always feel like we were always changing things, always adapting to things, always reacting to new situations. Yeah, I don't think we ever got the hang of things, but we just learned to adapt on the fly. And I think that's for the pandemic, really what caused us to do is really to quickly assess our programs, see what's working, what's not working, change it. And when new orders came in to the county, be able to change it real quick. So I think what the pandemic really showed us is that we cannot go back pre-COVID. We have to find a way to listen more to our students, to be able to really change our programs to make sure that we are meeting their needs. Because we know when they come back in the fall, that the needs will be more greater. So how can we truly sit down and listen to their needs and change our programs to make sure that we're meeting them where they're at?
Thank you, Ken. I love that idea of just kind of centering the voices of the folks that we serve. So I appreciate that. Alicia, this question will be for you. What did your partnership with Calfresh and other food resources look like throughout all the different phases and tiers of the pandemic? Will your organization continue with the partnerships it has developed throughout the pandemic?
I think that the different tiers definitely guided a lot of the conversations we had with families. With businesses being closed, many parents were laid off, working fewer hours. So we had more parents asking us about applying for Medi-Cal as a secondary, applying for Calfresh, WIC, and paid family leave. People were interested in getting screened for programs right away. Our protocol at First Five has always been to ask all moms seen at hospitals about Calfresh. For those who are already on the program, we help them complete the paperwork to add their newborn to their case. But for those who would like to be screened for Calfresh, we have set up a consent process with the outreach staff at Second Harvest for them to follow up with these parents. And for those of us who know Joel and his team, we know that they make applying for Calfresh easy for families. They are there to help them every step of the way, and they make the process less intimidating. So here at First Five, we definitely plan on continuing this partnership moving forward.
Thank you, Alicia, and thank you to all our panelists. I feel like we could continue to talk for much more time, but unfortunately, we do have to wrap up. So I want us to give a chance to go around the table and share some closing statements. If you could share some lessons that you've learned throughout the pandemic that it's taught you, and any words of advice or encouragement that you have for our audience. So Lawrence, why don't we start with you?
Yes, words of encouragement. It's very important to connect with the community around you, working with Calfresh, working with any organization that can support the residents and the community, and making sure that the most vulnerable, again, are served, and bringing services directly to them. Advocate just all the time.
Thank you, Lawrence, and thank you for your time. Canel, any lessons that you'd like to share, advice or encouragement for our audience?
Yeah, I truly think that we can come out of this better than we were before. And that's truly with partnerships. And I think with intentional partnerships. I think that what the pandemic taught me is this, that, you know, we can't do this by ourselves. With Calfresh, you know, Second Harvest Food Bank, the great work that they do with the county. But in order for us to really make the headways that we really want to do is really to reach out to more partners, more community-based organizations, working with the university, working with community-based organizations, working with the county, working with whomever is doing this work, so we can really make that change. Because without before the pandemic, we might have felt like we can do it on our own, but now we see that with community, we truly can make change. So really want to continue to work with everybody to make sure that, you know, we get things done.
Thank you, Canel. And Alicia, some parting wisdom?
I definitely agree. I think if there's one thing that the pandemic taught me is that we're more efficient as a community when we work together. I hope that definitely by this time next year, we're all vaccinated and hopefully having this forum in person.
All right, well, thank you all again, Canel, Lords, and Alicia. It's been great spending this time with you and getting to know a little bit more about your work and all the wonderful things that you do. So thank you so much.
Wow, all this amazing information. Thank you, Nick, Alicia, Kendall, and Lourdes for recognizing our efforts. Now, are you ready for some fun? Next, we are going to have you break out into pre-recorded breakout sessions. You will be directed to cooking club or Zumba. So if you get Zumba, get up, come on, turn on your cameras, don't be shy, come on, and Zumba. Once that is done, you will be returned to the main menu, a room. See you back soon.
I hope that next year we'll all be in person and we can Zumba together and share delicious meals. I want to say thank you to the YMCA for providing us the Zumba instructor, and also because we are able to share a cooking club. Delia provides delicious recipes, and the meals are always good and they're cheap on a budget. So, but for the next segment, we want to talk about our local disaster that happened. The CZZ Lightning Complex fire. And to talk about it a little bit more, we have, and the response it took from the disaster Calfresh, we have Gabby Davidson from Second Harvest Food Bank, Rocio Ortiz, Calfresh and General Analyst Santa Cruz County, and Maria Ornelas, Program Manager from Santa Cruz County Human Services Department. Sorry about that, we're a little bit out of breath, we're doing Zumba.
Good morning, everybody. My name is Rocio Ortiz. I am the Calfresh Policy Analyst and General Assistance Policy Analyst for the County of Santa Cruz. And we will be talking about disaster Calfresh and how it impacted our county after the CZU Lightning Complex fire. And I'm sorry if I can't match that energy that we just had in Zumba. So I apologize beforehand. So what is disaster Calfresh? Disaster Calfresh is a way to meet temporary nutritional needs within a 30-day period after a natural disaster happens. And it doesn't have to always be a natural disaster. It can also be, it may be a man-made disaster, but disasters typically include floods, fires, earthquakes. Disaster Calfresh operates during a 7-day application period that has to be approved by the Food and Nutrition Services. The benefit period is typically 30 days, but depending on the severity of the disaster, it may be extended longer. Disaster Calfresh is only available to those individuals who have not received Calfresh, who were not receiving regular Calfresh benefits during the disaster benefit month and benefit period. Sorry, can you go back one slide? One more. Disaster Calfresh becomes operational after a county affected by disaster is granted a presidential declaration of major disaster with individual assistance. As I mentioned, Disaster Calfresh provides a full month's allotment to eligible households affected by disaster. So when the CZU Lightning Complex fire happened, or Complex Lightning Fire happened, we wanted to start Disaster Calfresh immediately. Right away, we wanted to get the assistance out there and inform our community about what would be a possibility for them to have some aid. But we learned that it's not just us wanting to operate it. There's actually a process that has to happen, which we'll discuss in the next slide. So for how is Disaster Calfresh approved? This is a step-by-step of what we had to go through for the CCU Lightning Complex fire. The fire started August 14th and they burned for quite a while. Immediately we tried to mobilize and figure out how we would be able to deploy Disaster Calfresh and have the benefits available for everybody that would qualify. But we learned again that there's we needed a presidential declaration of a major disaster with individual assistance, which we got approved on August 22nd, and this happens through FEMA. Sometime in mid-September, the California Department of Social Services submitted an application to the Food and Nutrition Services requesting to operate Disaster Calfresh. So once the declaration of Presidential Declaration of Major Disaster is received, we work the CDSS or the California Department of Social Services and the county, along with other counties that were also being affected by fires, to develop a plan on how Disaster Calfresh would be operated in each specific county. That plan was then submitted to the Food and Nutrition Service, which is through USDA, and we didn't get an approval until September 29th. There it is defined what the benefit period is, the benefit month for Disaster Calfresh, and also the application period, because it is a defined 7-day period. We developed plans to operate it within the months of September through October, and our actual Disaster Calfresh application period was October 14th through October 22nd. And just some information about the Disaster Calfresh eligibility. To be eligible, an applicant must, household must, and it doesn't have to be a household, it can also be a family or individual. They must have been living or working in a disaster area, purchased or planning to purchase food during the disaster period, experience an adverse effect due to the disaster, and there's also an income limit, which is meet the Disaster Calfresh income limits. Adverse effects would be anything such as loss or loss of access to income, inability to access or inaccessible resources, and have had any deductible disaster related expenses. When we're calculating Disaster Calfresh eligibility, the net income is used, which is different from what is typically used for regular Calfresh, which is gross income. So for Disaster Calfresh, we're looking at the net income that the household took home during the benefit or disaster period month. And it is then added to accessible resources. So we add the net income to the accessible resources, and then we deduct any disaster related expenses that the household incurred during the disaster period. There we get the gross disaster income amount, and that's what we use to match it up to the Disaster Calfresh income limits. As I mentioned, Disaster Calfresh is only available for those individuals who were not receiving regular Calfresh during the benefit period or the disaster benefit period or month. But those households can and are able to request replacements if that is necessary. And we'll discuss that a little bit further into the presentation. Something to know about Disaster Calfresh is that typically populations who are not eligible for regular Calfresh may receive Disaster Calfresh, such as students, ineligible students, so students who didn't qualify for not meeting the student eligibility criteria for the Calfresh program, ineligible non-citizens, individuals who are sanctioned or disqualified, and individuals who are not meeting the work requirements. So now I will pass it on to Maria, who will talk about the eligibility determination process and more about how our benefit representatives assisted households.
Thank you, Rocio. Hi, everybody again. So this is Maria. And one big lesson that we learned in going through all of this was that we needed to better prepare our benefit representatives to know what questions to ask as we were getting phone calls. As Rocio mentioned, there is a program that is Disaster Calfresh, but then of course there's the need for Calfresh in a disaster. And when we started getting phone calls, as you can imagine, the same day that fire started and people were being evacuated, we were getting phone calls of people asking about Disaster Calfresh, and we kept reinforcing to them that there was nothing we could do until there was a presidential declaration, until the state, submitted a plan and got accepted and the counties could implement. But what we were missing was asking them, are they currently on Calfresh? And then we're talking about replacing benefits for them. And of course, in a future slide, don't go yet, but in a future slide, it's how to apply just for regular Calfresh. But in the replacement of benefits, once again, it is if the household has a misfortune or a disaster. Once the misfortune or disaster occurs, they have 10 days to request replacement of the benefits that they already spent. Go back to the prior one, thank you. And they have 10 days to apply, and they do that by filling out a form. It's called a CF-303, and that form can be found online by anybody. You just Google it and you guys can find it. They can, of course, call us also, and we can help them with it. We can approve the maximum monthly Calfresh allotment. Once again, based on the questions that we ask them, we'll make that determination. And they can submit a request for different disasters or misfortunes. This takes a little bit longer on the last bullet point, but we are able to, as a state, let the counties know that they are doing a mass replacement, just kind of based on zip codes. So like I said, we started getting phone calls right when the fires were happening and people are getting evacuated. They don't have access to their food anymore. And they knew that by the time they got into their homes, their food was going to be lost. The refrigerators were not working in a lot of instances. So they started calling right away. And like I said, for us, a tough lesson learned was to ask the right questions. Were they current customers of ours that we were talking about replacement? Because the customer didn't know better and they were just saying, I want to apply for disaster Calfresh. And that took longer, as Rocio showed. So going forward, for all of your information, if people are reaching out to you, let them know there is a form, let's fill it out, let's get it into us so we can start working on replacing the benefits. Next slide, please. And then, like I said, the other thing that we were so caught up in the disaster was to not really kind of ask the questions about just regular Calfresh. It doesn't stop being a need. Some people maybe never thought that they wanted to be on Calfresh or didn't know about it. And as they're getting that information, we could see if they're eligible just for a regular Calfresh at that moment. Next one. I'm not going to read this because we're on time crunch, but there is a lot of information if you just Google Calfresh. And one of the sheets that you'll find is a lot of information on who can possibly be eligible for Calfresh. So whether it's a disaster or not, and you're talking to individuals, family members, adults, and they want to see if they can be approved. Like I said, they can Google the information themselves. They can call us. They can, go into one of our walk-ins, get the help from you. But here's some bullet points of who can possibly be eligible. And like I said, I'm not going to go bullet point. I just wanted to put this up here so you know that there is information online. And one thing that I do really want to call out is that while we do consider the income for Calfresh, there's not a resource limit. So effective October 1st of 2018, resources will not be counted for most households when determining eligibility for Calfresh. And some people, because this is still 2018, sounds, a few years ago, but for a lot of people, they don't know that. And in the past, if they got denied based of further resources, they're not applying. They're not applying again. So just to let them know, while we will go do an income for a budget for their income for resources for Calfresh is not a factor. Okay, and I think Gabby, you're next.
Okay, thank you. So as we reflect on the CCU lightning complex fire and COVID-19 pandemic, it is important to think about how we can better prepare ourselves to help even more people enroll in benefits, as many people may have been unaware about these benefits or have faced barriers to getting help. We need to be as prepared as possible so that when a disaster happens, we can be quick and efficient when giving people the help that they need. Organizations can begin preparing for the next disaster now by starting an SOP, which is a standard operation procedure, a step-by-step instructions to help workers carry out routine operations. thinking about what your role and your coworker's role would be during a disaster, thinking of agencies you can reach out to for support, and creating a sample work plan are all ways that you can start now to prepare for when a disaster strikes. As our team saw while doing outreach during the fires, it can take a few weeks or months between when a disaster strikes and disaster Calfresh is available. During this period, it is crucial to network with social service agencies and community resource centers to begin promoting your services. The Second Harvest Food Bank Calfresh team attended events at the Santa Cruz Resource Center, as seen on the right, and the Ben Lomond Resource events to help people, to help get contact information of people interested in applying for disaster Calfresh when available. And we also assisted on the spot with regular Calfresh applications. Once disaster Calfresh was approved, we already had a list of people to contact to pre-screen for disaster Calfresh. And we got this information through one-on-one conversations we had from community members and also partnering with the people running the registration tables at events, as many of them were already getting the general information from people entering their facility. Many of the resource centers first available were shortened or closed by the time disaster Calfresh was approved. So that's why it's important to continue to do outreach and find places or agencies that can help with your outreach efforts. Once disaster Calfresh was approved, we partnered with the Disaster Calfresh Center with the Davenport Resource Center to do outreach in an area greatly impacted by the fires. In addition to attending outreach events, you can reach out to other agencies or businesses who can promote your services to employees who are laid off or are experiencing food insecurity. For instance, we noticed that a lot of restaurants were giving free meals to those impacted by the fires, and so we asked them if they could hand out our flyers with the take-home meals. Even if your organization is unable to go to all events in the community, use your network, such as volunteers, to do some outreach for you. It is our responsibility to make sure our community is aware of all services available to them during a disaster. By educating and engaging community members through flyering, attending events, going on the news or radio, and using social media, we can make sure that those who qualify know about our benefits. During the CZU fires, hundreds of people were joining Facebook groups centered around where to find resources. And that's a great way for you to do outreach. You can also go, like we did, to impacted areas and pass out your flyers to businesses that are still open, such as maybe some churches or restaurants. You can use this disaster preparedness checklist, which we will be adding to the chat, as a reminder of where to start when preparing for the next disaster. Remember, you can always reach out to the Second Harvest Food Bank for trainings on outreach and on Calfresh. If you have any questions that we cannot get to today, you're welcome to email me at Gabby at the Food Bank and Rocio Ortiz. Thank you.
Thank you, Rocio, Maria, and Gabby for that great information. How much fun was Zumba and the cooking demo? I enjoyed it very much. Hope you did as well. Next, we have more Calfresh Champion Awards. To introduce those, we have someone very special to us that has been with our organization for over 6 years. Trisha Wine, Board Chair from Second Harvest Food Bank. Thank you.
Well, good morning, everybody. This is really a distinguished group and I'm honored to be part of it. So I have the pleasure of presenting the next set of Calfresh Champion Awards. So the 5th Calfresh Champion Award goes to the County Clerk's Unit from the Santa Cruz County Human Services Department. Without our County Clerk's Unit, the work we do to provide Calfresh benefits would not be possible. They work hard every day, uploading verifications, registering applications, talking to customers in our walk-in offices, and much, much more. Thank you, administrative assistants, to the WP10 unit, the BP20 unit, and the EP10 unit. Thanks so much, and congratulations on your award. The next award goes to Araceli Castillo, Community Health Outreach Worker at Salud para la Gente. She says, I am very proud of the work I have been doing for over 20 years as a community health outreach worker. Having food on the table is for many the first step in a healthy lifestyle, and I appreciate the opportunity to assist local community members obtain obtain Calfresh benefits. Having money to purchase nutritious food is crucial for a household's overall health. Hence, collaborating with the healthcare settings such as Salud para la Gente to get referrals for Calfresh benefits is important in making our community healthier. That's right. Thank you very much, Araceli. Our 7th Calfresh Champion Award goes to registered nurse Renee Ispuru Gonzalez from the CATS Cancer Resource Center. Even with a busy schedule, Renee sees the importance in connecting her patients to Calfresh and is a Calfresh outreach buddy with the Second Harvest Food Bank. Renee said that connecting oncology patients with essential nutrition is of utmost importance, especially during chemotherapy, surgery, and radiation. Patients need the micronutrients to help them recover from cancer treatments. Oftentimes, patients are not able to work and have a decrease in their income. Second Harvest is really a gold mine of essential resources for our community. Thank you for the consistent collaboration and teamwork in getting benefits in the hands of people who need it the most. Thanks so much, Renee. Our 8th Calfresh Champion Award goes to Maricela Uduk, who is a benefit representative at the Santa Cruz County Human Services Department. Without benefit representatives like Maricela approving people's cases, people would not be able to get Calfresh benefits. Maricela is patient with her clients and goes out of her ways to break down barriers by helping to walk clients through how to get pending verifications for their case. She says, I've been a benefits representative for Santa Cruz County for 6 years, and it's the best part of my job when I can make the Calfresh application process and interview an easy experience for the customer. The most rewarding part of my job is being able to determine someone's eligibility for Calfresh and knowing that the family will have assistance in purchasing food for their table. Thank you so much for all you do. Lastly, we would like to congratulate the Santa Cruz County Watsonville Health Center in recognition of their passion and dedication to end hunger and malnutrition through the Food RX program. This program connects people who may be facing food insecurity with the food bank so they can get pre-screened for Calfresh and learn about our food distributions. They would like to say that the COVID-19 pandemic has had a disproportionate impact on low-income families in our community. Having an opportunity to partner with Second Harvest Food Bank's Food RX program has allowed us to provide patients and families with easily accessible resources to obtain healthy, nutritious food, and at the same time to alleviate stress and anxiety that accompanies food insecurity. Congratulations again to all of our Calfresh Champion Award nominees. We are excited to continue our collaboration with you all, and to continue to see the positive impacts you have on our community. You inspire us. Thank you very much.
Thank you, Tricia, and congratulations to all the Calfresh Champion Award recipients. Up next, we have Alexis Fernandez, and she will be sharing some very exciting information about a pandemic EBT.
Hi, Rocio and everyone. My name is Alexis Fernandez, and I am the chief of the Calfresh and Nutrition branch at the California Department of Social Services. My branch oversees about 7 federal nutrition programs, as well as a handful of state programs. Our kind of flagship program, if you will, being the Calfresh Food Benefit. But today I'm actually here to talk to you about a unique program that we have been administering as part of our response to the COVID-19 pandemic emergency. So I am going to try to share my screen. Bear with me while I get my slides set up. And today provides some really exciting updates. I'm actually glad that I get to come to you with good news today. So give me a minute just to put this into slide mode. And we'll go ahead and get started. Okay, Rocio, can you confirm that you can see my deck? Or someone in the chat?
Yes, we can.
Great. Okay, so let me go ahead and jump right in. So as background, if you're not familiar yet with pandemic EBT or PEBT, it provides food benefits to children that are normally eligible for free or reduced price meals at school, but because of COVID-related school facility closures, may not have access to those meals readily. And so we administered the first PEBT or PEBT 1.0 last year, and we were recently authorized as states to operate pandemic EBT for the current school year, which is 2020-21. We call that PEBT 2.0, and you'll hear me reference that throughout the presentation. And the really good news is that PEBT 2.0 is not only for school-age children, but also for young children ages 0 to 6 that are receiving Calfresh. I'm going to talk a little bit about eligibility for both of these groups just to get us started. So for young children, PEBT 2.0 is going to be available to children who are aged 0 to 6 and are part of a household that is getting Calfresh food benefits. They also have to be living in a county where at least one school is closed or is limiting in-person instruction, which in California is the entire state. So as a practical matter, PEBT 2.0 for young children is for kids that are 0 to 6 and receiving Calfresh. PEBT 2.0 for school-age children is a little bit different. School-age kids, transitional TK through age 22, have to be enrolled at a school that participates in the federal nutrition programs. So the school has to be participating in the school breakfast program or the national school lunch program. The child has to be eligible to get free or reduced price meals. And then we have to be able to assume that they were attending school via distance learning at least some days of the week. And we're going to make those assumptions based on data collected from schools. More on that to come. So the good news that I can share today is that our plan to issue benefits to young children was just approved by USDA. So this is very exciting news. It was approved for benefits that cover the period of October 2020. I see the typo on my slide. That is October 2020 to May 30, 2021. And today, because this was just approved, I'm going to go into some detail for young children, but let me also highlight that for school-age children, our plan is still pending. We've been working closely with our partners at USDA to understand what we need to get approval, but we're not quite there yet. So again, just to reiterate, we just got our young child plan approved and we're still working on our school age plan, but hope to have good news to share on that front very soon. And then the last update is that summer pandemic EBT was just announced. So as soon as we have our school age plan underway and approved, we'll then turn our attention to summer EBT or summer PEBT that will be available to young children and school age kids who got benefits for the school year. So lots of benefits will be flowing into California. We're just kind of stacking all these efforts in order. Today, let's go into our young child plan in just a little bit more detail since it just was approved. As I mentioned at the top, children are eligible for PEBT 2.0, young children that is, if they are aged 0 to 6 and they are getting Calfresh food benefits. They also have to be living in a county where at least one school facility is closed or limiting in-person instruction, which is all of California. At least it was for this school year as we reopen. So let's go into a little bit more detail around eligibility. So I mentioned that all children under 6 who are or were a member of a household receiving Calfresh are eligible. They have to have received Calfresh between October 1, 2020 and May 31, 2021. If they receive benefits in any of those months, they'll be eligible for PEBT. Based on guidance from USDA, it's month by month. So they will receive PEBT for the months in which they were receiving Calfresh. Let me give you an example. If a young child age 0 to 6 was receiving Calfresh for the month of October, they are going to be eligible for PEBT for the month of October. If that child left Calfresh in the month of November, they were no longer receiving benefits, they're not going to be able to receive PEBT, unfortunately, and that is because of a federal rule. So to further determine eligibility, because being 0 to 6 and getting Calfresh are just two of the criteria. Remember, the third is that you have to be living in a county where a school was closed or limiting in-person instruction. We will confirm that each child's home address is in a county where that exists. At least one school was closed or operating reduced attendance or hours. Once we've determined that you live in a county where a school was operating all distance learning or all hybrid learning, we'll use that information to determine your PEBT benefit amount. So we're going to have two PEBT benefits for this group. The first benefit is $123 per month for young children that live in a county where at least one school was providing all virtual or all distance learning. This is going to be very common because many schools across California were closed. Let's walk through an example. If you were receiving Calfresh in October, you're 0 to 6 years old, and you live in a county where at least one school in October was all distance learning, you are going to be eligible for $123 for that month. The second benefit amount for PEBT is $68 a month. And this is the benefit amount for kids that live in a county where in that particular month, there were no schools distance learning, but there were schools offering hybrid instruction. If we can't find a school that was distance learning, but we can find a school that was at least offering hybrid instruction, all the kids in that county are going to receive the $68 a month PEBT benefit. And then the last category is no benefit. So if you were residing in a county where all schools were offering all in-person instruction, then no children in that county will be eligible for PEBT. This is going to be very rare in California. During the school year, many schools were closed or offering hybrid instruction. But as schools reopen, if schools in that county were offering all in-person instruction, then the children in that county are not eligible for PEBT 2.0. Let's talk a little bit about issuance. So importantly, there will be no PEBT 2.0 application. This is really important, no application. Eligibility is going to be determined based on a combination of the Calfresh enrollment information we already have and then information about schools in that county. All eligible kids will receive their PEBT cards directly in the mail based on the mailing address we have on file for Calfresh. Each eligible child is going to receive a new PEBT 2.0 card. They should keep that card. It will be reloaded over time. But importantly, no application for PEBT 2.0. Let's talk about timeline. So before we can actually issue cards, we've got to do a lot of work on our data on the back end, but we also have to educate clients that PEBT 2.0 is coming. So we are going to launch a client education campaign in early June. There will be webinars and other virtual events to launch that campaign. It will also include direct mail postcards to all eligible children so that they know that PEBT 2.0 is coming. We will begin mailing cards in late June for children who received Calfresh October through January, and then cards will follow for children that received Calfresh February through May. We will have a lot more details at the launch of our education campaign, as well as in our PEBT stakeholder meetings. If you're not yet tuned into those, send me an email. My contact info is coming and we'll get you signed up. School age children and summer PEBT. So let me just circle back. I mentioned that there's PEBT for young children, PEBT for school age kids, and then summer PEBT that's coming soon. So we're going to launch PEBT for young children, And then as soon as our plan for school-age children is approved, we're going to follow with issuing benefits to school-age kids. And then once those programs are underway, we'll follow both of those with summer PEBT benefits for both young children and school-age kids. We still need to develop a plan and submit that for USDA approval, but that's the order, right? Young children first, school-age children next, and then both for summer benefits. I'm going to take a look at the chat in just a moment. I've left you with a slide here. If you want to get signed up for our all stakeholder meetings, email Harris Rahimzai directly. You can get signed up and registration links for those meetings where we're going to go into a lot more detail on this topic. So with that, let me stop sharing my screen. Let me ask Rocio if I have time for a couple of questions.
I think I saw just one that came through that asked, what should parents do if a child receives a PEBT card via mail and parents believe they don't qualify for Calfresh?
Yes, so if a child accidentally receives a PEBT card, they have the option simply to destroy it if they don't want to accept benefits. Let's say someone was eligible, but they don't want PEBT benefits for whatever reason, they can also just destroy their card.
Thank you, Alexis. And I see one more.
Okay, and I got a couple of direct messages as well.
Okay. And if we can collect the questions and then we can have them answered later as well, if everybody's okay with that.
Let me do one that's, I think, going to be common, Rocio. It's unique to PEBT, is we operate retrospectively, which is totally different, right, than Calfresh. Calfresh is based on your prospective eligibility. PEBT is your retrospective eligibility, so we're looking backwards. So when we issue PEBT benefits, families are going to get a card that represents benefits for months in the past. So, for example, the first PEBT cards mailed for young children are going to be loaded with benefits for October through January. So families are going to receive this card if they were on Calfresh October through January. Then our second wave of cards are going to have benefits for February through May. And so again, it will be retrospective. And if you're thinking, Alexis, this is so complicated, how am I supposed to keep this all straight? We are going to have kind of charts and graphs with different images to show families kind of self-service what benefits they've received looking backwards, if they should be anticipating a card, if they're going to be in the second wave of mailings, and also so that you can help families kind of understand what's happening. It's quite complicated and we're dealing with a really long period of time, but again, we're looking backwards.
Thank you very much for that. So I will collect the questions that I have here in the public chat, and I can send them to you, Alexis, if that's okay.
Yeah, that's great.
Thank you.
Hello, welcome. Thank you, Alexis, for all that great information. Up next, we have Josue Barajas, Chief Officer here at Second Harvest Food Bank, who will be doing the introduction to our keynote speaker. Josue, you're next.
Thank you, Joel. And so now it's my honor to introduce Congressman Jimmy Panetta, who is dedicated to public service and proudly serves California's 20th Congressional District in the United States House of Representatives. His district includes Monterey and San Benito counties, as well as parts of Santa Clara County, and of course, Santa Cruz County. He was first elected in 2016. He is serving his third term in Congress now. He currently serves on the House Committee on Agriculture and the House Committee on Armed Services. And without further ado, here is Congressman.
Hello, everybody. I'm Jimmy Panetta, the United States Representative for California's 20th Congressional District, located on its Central Coast. It's an honor to address the 9th Annual Calfresh Forum although it is a bummer that I have to do it virtually. However, I admit it's my absolute pleasure that I can take this time to thank all of you, especially after one heck of a year of the pandemic, during which each and every one of you rose to the occasion. Seriously, at a time when we were asking everybody to stay at home and saying it's okay to watch Netflix all day, you actually got up, you stood up, and you stepped forward to serve the most vulnerable communities in California at one of our most precarious times in our history. I do believe that when we look back at this pandemic, people will look to what you did, or what our food programs and our food banks did, and once again, be proud of all of your work, especially if your communities are like my community and have the same type of dedicated people to our food security. Now, there's a few people there who have contributed so much to putting food on tables here on the Central Coast that are joining us virtually that I want to give a shout out to. Randy Morris with Santa Cruz County as the director of the Human Services Department. Of course, Willie McCrae, CEO of the Second Harvest Food Bank, and all of the staff and advocates there at Santa Cruz County who are tuning in virtually to this event. Thank you for everything that you did for so many and everything that you will continue to do to put food on tables for those who need it the most. Now, if there's one thing that this pandemic has made clear, it's the importance of SNAP and Calfresh to every household that faces food insecurity. Since the start of the pandemic, the number of American households experience hunger has doubled. In households with kids, it has tripled. The trend is clear, it's simple, but the impact is devastating. As Americans remain unemployed, people are having trouble putting food on the table. Now, many families turn to food banks. I saw this firsthand as I often volunteered over the past year with the National Guard and the food bank employees loading food in people's cars. And I learned a couple of things, especially how to open up the trunks and hatchbacks of literally every type of car. But I also saw every type of family driving those cars, waiting in lines that grew longer and longer. Now, it's understandable that statewide, 1 in 10 Californians now relies on food banks. In my district, in the food bank of Monterey County, they went through 6 months worth of food inventory in just the first 7 weeks of the pandemic. Now, let's be clear. Our food banks did an amazing job. But if hunger brought on by the pandemic is a debilitating condition, then food banks, while an essential and critical service, are really only treating the symptoms. By contrast, Calfresh helps treat the root causes of hunger. That's why I firmly believe that we must continue to increase the federal resources so that you can continue to respond to the hunger created as a result of the pandemic and other issues as well. Now, as a member of the House Agricultural Committee and as a member of the Central Coast community, I've come to believe that we cannot food bank our way out of this pandemic. And what I've learned, instead of building a new supply chain from the ground up or passing the responsibility on to overwhelmed charities, we are better off when we invest more in Calfresh. Now, although we in Congress passed the Families First Coronavirus Response Act, the emergency allotments provided in that bill still left as many as 40% of SNAP households without any increased benefits. Thankfully, we kept on plowing ahead, and we passed the American Rescue Plan that increased SNAP and Calfresh benefits by 15%. A truly excellent foundation for what can be done and what is needed to be done all across our country. You know as well as I do, we got a lot more work to do. And as a member of Congress, I will continue to push for investments in more sustainable, more substantial, and more accessible SNAP benefits. And as a community member, I'll continue to support my local food banks, but ultimately, it comes down to being an American, and it's all of our responsibility to make sure that our nation is food secure. So once again, thank you. Thank you for all that you have done, and thank you for all that you will continue to do. I look forward to working with you to live up to our obligation to making sure that we have the security that is needed when it comes to putting food on everybody's table. Thank you.
Thank you, Jimmy Panetta, for these words. Next up, we have Matt Weissner, Directing Attorney of Community Action Board in Santa Cruz County, who will be speaking about the changes in the public charge rule.
Right. Thank you all very much for this amazing forum and for all the speakers that have gone before. My name is Matthew Weisner. I'm the Directing Attorney at the Community Action Board of Santa Cruz County. And our immigration project provides immigration legal services throughout Santa Cruz County, Monterey County, and the Central Coast. And thanks also to Congressman Panetta for his words and for his support of these programs and for his support of immigrants' rights here in the United States and in our communities. So today I'm going to talk to you just for a few minutes about public charge. And first I want to start off with what is public charge. And I'm going to make sure that my screen is sharing so that you can see this presentation. So what public charge is a federal regulation used to decide whether to grant applicants a green card. This is basically a wealth test that determines whether an individual seeking permanent residency here in the United States is likely to become dependent on the government for support in the future. Now, public charge has been part of federal immigration law for many, many years. As you can see on the screen, it goes back well into the last century, and most recently was codified under the 1999 Field Guidance. And the reason we're talking about this today is because Calfresh and other benefits programs and public charge have often had very mixed relationship. And we want to make sure that all of us here in our community understand what are the immigration consequences of receiving certain benefits. So under the Trump administration, a new harsh public charge rule was proposed in 2019. And this 2019 public charge rule sought to limit the individuals who could receive green cards who had any sort of public benefits use. So this rule would have punished families who received Medicaid or Medi-Cal in the state of California, or Calfresh, or other public benefits that they may have needed to rely on in order to support their families through hard times. And last year, the Department of Homeland Security did actually implement that Trump-era public charge rule, even while it continued to be litigated through the federal court system. Now here you can see we have a new administration. The Biden administration has taken office since January 20th of this year. And with the Biden administration came some very important policy changes. So Biden signed a number of executive orders early on, and this public charge rule was actually benefit of a federal court decision. So the Biden administration decided not to defend the Trump era public charge rule as it made its way through the court system. And without anyone defending this harsh immigration rule, what happened was the Supreme Court had no choice but to dismiss an appeal. That effectively ended the very restrictive Trump era public charge policy. So what happens now to all of our clients and our community members who are concerned about receiving public benefits is it reverts back to the 1999 public charge field guidance. So what this means for us is that we have some whiplash, and it's understandable if you all, and I know that our departments feel this way. These policy changes are really ground shaking, and they do have very significant impacts for families in our community. So what's happening now? What's the current rule? So the current 1999 field guidance says that a public charge is a person who's likely to become primarily dependent on the government for subsistence. But it looks only at receipt of cash benefits and long-term institutionalization for Medicaid. So in effect, what we're talking about is receipt of SSI, general assistance, temporary assistance for needy families. Those cash benefits can still have an impact, but programs like Calfresh or Medicaid for regular use, non-institutionalization, those benefits are now safe to use for those who are eligible. So for immigrants who are looking to become permanent residents based on a family member, they will rely on this sponsorship as they have in decades past without such a critical analysis of whether the family has received any public assistance such as Calfresh in the past. So who are we talking about when we're looking at public charge? This is only applying to a certain subset of immigrants in our community, particularly those who are applying for green cards through a family member. It does apply to some other limited groups and non-immigrant visas, but the way we'll see it most in our community is those individuals who are seeking permanent residency or a green card through a family member. So in our community, they still may want to ask an immigration attorney or their benefits worker about cash aid, but programs like Calfresh are safe to use. Another note here you'll see on your screen is that many undocumented or otherwise otherwise undocumented individuals won't qualify for many of the public benefits that do cause harm here. So that's an important criteria to keep in mind as well. So what benefits are currently safe to use? We're talking about WIC, Medicaid, disaster relief, pandemic relief, and of course, Calfresh. So those other benefits on the screen that you can see here are now safe to use. They will no longer be considered as part of a wealth test by immigration to see if an individual qualifies for permanent residency. So for our communities and our clients, there are no negative adverse immigration consequences to receiving these benefits now. Of course, we do always emphasize that they should otherwise be eligible and to carefully look at their own eligibility for these benefits before applying for them. We do want to make sure that those eligibility criteria are met. So just to recap a few of the key points from today, a family member or child's use of public benefit programs does not affect a household member's public charge. COVID-19 treatment, vaccinations, testing will never be considered under a public charge test. Similarly, pandemic relief, medical care like Medicaid, both emergency and full scope, similarly are not considered under the public charge test. And the use of health and nutrition programs like Calfresh are also safe to use. So I hope that you will all consider that takeaway. And I really appreciate all of your hard work on this area. It's very important to us and our clients. And thank you very much for your time and consideration.
Thank you, Matt, for the great information. We appreciate it. Again, if you guys have any further questions, please don't hesitate to reach out. You can either reach out to us, ask the questions on the chat box, and then we will get back to you. Next, we have again our closing remarks, and that will be the end of our program. And for that, we're going to call back Josue Barajas, which is our Chief Programs Officer here at Second Harvest Food Bank.
Thank you, Joel. And thank you so much for everybody that took part in this forum. We are very saddened that it couldn't be done in person, but we're very glad that we were able to pull together such a large group of community partners and community support to make this happen. I want to give a shout out to everybody who presented and everybody who took the time to be here today, who got an opportunity to also be here for parts of it. Again, one thing to take away from this whole thing is that this pandemic has truly shown us that we can't mask hunger and that we really need to address food insecurity in our community, and that Calfresh is the only way that we can continue to support our families and be able to give and provide healthy meals to those families in need. So now I continue to challenge you to take something out of this presentation and out of this whole morning and share it with somebody out in your community. To end on the note, I'll share two things. I will put on the chat two ways that you can continue to stay connected with us. We are on Facebook and we are on Instagram. So feel free to follow us on both of those pages. And I'd also like that as people are starting to log off and enjoy the rest of the afternoon, the announcement that remember to please complete your evaluation in order to get your free t-shirt and a goodie bag. So make sure to stay on the lookout for that email so that you can complete those two things. We're always looking to improve, and with your help and support, we'll be able to continue to improve this event. And lastly, please share a word, a message, or something that you're going to take with you out of this event so that we can all continue to see it, and hopefully we'll able to combine it and send out a document sharing what everybody else is talking about. I know for myself, after being here and listening to all this, I am continue to be hopeful for the future and super thankful for all of our community partners. So thank you, and look forward to be here to see all of those things that you all are going to take away and continue to share out into the community.
Sayonara, everybody. Enjoy your day. Go and spread the joy of Calfresh into the community. And don't forget to do those surveys. And you will get a t-shirt, make the arrangements. Again, it has a very cool message. I don't know if you can see it. Okay, well, you will see it when you get it. This is officially the end. We thank you guys and have a wonderful day. Thank you very much. Appreciate it.